When you look at blockchain as both a technology and as its implementation into the healthcare industry, where do you see it in terms of maturity?
As a technology, blockchain is a composite use of a lot of technologies that are actually in a legacy category. There's many things that we're using from a tech perspective that aren't new in any way. They're not particularly novel. We do have an unusual first ever intrinsically longitudinal data structure with directed acyclic DAGs and DLT tech and blockchain as a data structure. But what we're using to cryptographically verify each transaction is not intrinsically new. Distributed systems architectures aren't intrinsically new. The cloud computing is legacy at this point. So what we have is an assemblage of previously existed proven technology put together in a brilliant, innovative way, and then where we have game theory and behavioral economics layered on top of it. So we're talking about something that's not just a technology, it's also brand new disciplines being brought to bear in a way that we don't yet know how these behavioral economic experiments will actually work. What we have are really compelling hypotheses. What we have are known distorted incentive structures. We know what those are, and we have great ideas about things that might work. If we ran them as experiments, they might produce the result. In terms of where we are, I believe we should be approaching all of this very empirically. We should be thinking of these things as experiments that we need to run, and things that we need to learn and discover about what does and doesn't actually produce the desired result. And those are partially technical experiments, but I would say the majority of what is involved with it is not technical. It's clinical, it's social, it's economic, it's legal, it's governance, it's ethics, it's new structures and systems that we need to run them, and we need to observe them very carefully and see what's actually happening. That means we should be approaching these projects and initiatives as studies and executing them under research protocols. That is not something I think more of us should be talking about. That it's a real priority of mine to see that work getting done in the construct of studies, which I think is one of the only ethically viable ways that you could move to the point of experimenting with this technology. Doing things like this under a research protocol, it's a walled garden from the perspective of technology infrastructure, from protocol, ethical oversight, funding structure. It's a microcosm that I think of as a walled garden. In that model, we can do work and see what happens. That's the point, to learn what happens that we would not be able to approach doing in mainstream medicine. And I think that's the stage that we are moving into now. The other thing that has happened finally is that there has been a tipping point in the understanding that the question for an organization to be asking is not, how do I use blockchain technology? Finally, the tipping point has come that it's how do we use blockchain technology, and who is the we? And sometimes it might be my competitors, and others it might be my trading partners, and many it might be my constituents, my patients, the actual human beings involved in an ecosystem. So when you start thinking about it as the we, how do we do this, and defining who are the parties and what are their needs, and how can their incentives be aligned, and how can you use cryptoeconomic models to experiment with those hypothetical incentives, because we must remember we don't know how it will work. What we have is a good idea. We have reason to believe that it's worth doing the experiment, and then whatever we learn will be valuable, including null findings. So that's where we are right now. We're moving to formalizing ecosystems and consortia, where we are maturing governance models. We're recognizing the need for governing entities in the picture. We're recognizing the need for ethical intentionality and structure from a methodological perspective, that ethical design phase needs to be formalized and incorporated. And I hope to see our industry recognizing the need to do this work under studies and use the walled gardens of research protocols as how we're able to advance ahead of knowing the answers conclusively, such that they could be scaled out in mainstream medicine.
So looking forward then into 2019 and beyond that, what excites you about blockchain and healthcare? What are some things that you are eager to see happen?
Oh my goodness, I have a great passion for seeing the entire wide arc of research and development and innovation all the way through to commercialization from bench to bedside, as they say. It's about 17 to 25 years on average from the time that a discovery is made in a laboratory to the point that it is treating someone's disease or reversing their cancer or preventing their diabetes, for example. There are so many points in that long, wide process where we can strip time, costs, risk, efficiency. We can strip all those things. We can bring the timelines in. We can bring the costs down. And what that means is something that my good friend and colleague, Dr. Sean Mannion, calls faster miracles for all of us, for each of us who are living beings that are subject to the common human experience and preventable suffering. We also have the opportunity to democratize and equalize disparities and access to care using these models. Some of the reasons that those disparities exist are because of distorted incentives, because we don't have models where we can create the motivational systems. The reasons that people can't get access to care aren't because there isn't enough health information technology in the world. So we have the model, we have the possibility to do great good. That's why I keep talking about ethical intentionality, because it's the deliberate focus on knowing that those opportunities are there and doing the hard work of discovering them and then validating them experimentally and scaling them out. So, faster miracles through the entire wide arc of clinical research to translational medicine, back to guidelines, back to validation. We can speed that process. We can save a huge amounts of financial resources that then can be fed back into that virtuous cycle to speed that process. And I think that we can design a future where we don't leave behind our most vulnerable members of our population. And I'm very excited about those things. I'm moved by those things.
Can you talk a little bit, just kind of pivoting off of that point, can you talk a little bit about what you look forward to working on yourself going forward and how you see yourself making changes within this space?
Well, I have a number of ways that I feel that I can personally contribute, and I hope to personally contribute. One of those ways is through my role at Consensus Health. We are uniquely positioned to influence the development of viable cryptoeconomic systems that can affect these distorted incentive models on the Ethereum platform, and using the technology that we're building and developing, and the ecosystem of partners and collaborators and allies that we're working with. In my roles and the hats that I wear with IEEE, I have an opportunity to coalesce stakeholders around a common vision and engage individuals and the broadest possible group of stakeholders to give a voice to their priorities. One of the most important elements about applying ethics as a verb, as an active process, is doing the work to make sure that you're making your really best effort at getting those stakeholders at the table. Because it's inconvenient and it's difficult. And if it were easy, it would already have been the way that we approach it. So I'm really passionate about doing that hard work and and seeing the benefits of that come to pass. So it's a great honor to be a part of the IEEE organization. I'm very proud of them and honored to be a part of what they're doing. And I think that the HIMSS organization also has a tremendous amount of value to add globally. They're another global institution that's a terrific vehicle for education and a trusted resource for health information technology professionals globally who are, you know, the tip of the spear of needing to evaluate and utilize this technology. So I think it's a wonderful opportunity to be part of these different organizations that play very different roles, but they're complementary, and they all align in a vision that I carry in my mind as I'm moving between these roles. As a new practitioner, beginning to learn about this technology and its potential, the most important thing I would remind you is that blockchain isn't only technology. It's also behavioral economics and game theory. It's an opportunity to apply those new disciplines to our field, and we've never had any tools that we could use to apply that thinking, and now we do. So it's all the technology, and it's so much more than that. The other thing I would encourage you to do is to think even bigger than you're thinking right now. Think about moonshots. Think about wholesale improvement, 10x value. Think big, and I would encourage you to do that, because the other thing that I have to edit that little bit, that didn't work. Another really important idea is that blockchain doesn't exist in isolation. It is hitting viability, commercial viability, industrial viability at around the same time as many other equally revolutionary innovations. So there's a great convergence happening with this technology. So it's also thinking about the whole family of artificial intelligence technologies. Just the combination of putting natural language processing and robotic process automation together with smart contracts and blockchain, and you didn't even enter the Internet of Medical Things into that picture. And oh, by the way, how about 3D printing drugs or organs and so on? So we have this great convergence of totally revolutionary technologies all hitting at the same time, and we also are required to rethink the way that we secure our information. The increasing attack frequency, severity from a cybersecurity perspective is just as all of this exponential value is potentially being created, so too does it represent new threat vectors and risk. And so we also need to think of blockchain as an entirely new architectural paradigm for how it is that we secure our information. And that's equivalently important, to focus on both the benefits and the risks in parallel, and to think bigger than just blockchain the tech. Blockchain is the tech plus behavioral economics plus game theory plus the convergence of everything that's happening in concert. So think big.